So with cataracts on vision, people wonder, when is it time to have cataract surgery? And there are sort of different ways that we can think about the vision and the way the eye works to help us decide, is this now a good time for you to have a cataract surgery, or should we just get a new pair of glasses and continue to wait? What I like to think about overall, are you able to function in your daily routine? Do you like to drive cars? Do you play golf? Do you read piano music? Are you able to function at the same level now with your vision comfortably as you always have? If your answer is that it's not that bad, and if we have you, after you come into the office, basically check for glasses, and we see that we can correct you back to where your vision has been in the past, then now is not the time for you to have a cataract surgery, even though the doctor may tell you that you have a cataract in your eye. A cataract is really just a change in the natural lens of the eye. As we all age, the lens protein is continuing to thicken and harden and change its consistency. Some cataracts cause glare, some cataracts cause just sort of a foggy vision. Some cataracts for patients are very debilitating. They just really can't see much of anything. And so other than the real obvious, you cannot see at all, there is a subtle art to sort of deciding when your cataract is ready for cataract surgery. Most of my patients, I find, especially with modern day life and driving in twilight hours or at dusk, find difficulty with driving at night. Oncoming headlights prove to be very problematic. You start having difficulty seeing street signs, or just sort of common things that you once were able to see in focus are no longer able to be very well seen. So when you come in for a cataract consult, first thing we're going to do is probably a lot of testing. And the testing, the point of it is, we know you have a vision issue. We think it's from your cataract, and most of the time it is, but sometimes we're surprised to discover something else about an eyeball is also contributing to some blurry vision. The retina is a big source of some of these surprise findings. Sometimes there's these little membranes called epiretinal membranes. There can be other changes in the retina, such as blood vessel problems or bleeding in the back of the eye. Optic nerve issues do arise for people with glaucoma, and then sometimes it's the front of the eye, the cornea. So we like to take images of your cornea to understand the shape of your eye. We like to look at the retina to make sure that there's nothing abnormal or atypical about your retina. Assuming everything about the eye seems to be fairly normal, what we then do is we do some stress testing on your vision with bright lights. We check to see, can you still read the chart? We call that glare. If you have substantial decrease in the quality of your sight when we have a bright light in your eye versus when there's no bright light in your eye, that's typically from your cataract, and that's when making a decision to have cataract surgery would be a good idea. There are many different techniques available to surgeons to remove cataracts. Historically, before we even had phacoemulsification, cataract surgeons were removing cataracts with just simple surgical tools. It took much longer for patients to recover from that type of surgery, but that surgery is still commonly used around the world where we don't have access to all the modern day equipment. Here in the US, most cataract surgeons are going to be using phacoemulsification to fully remove the cataract. And then depending on the clinic and depending on the location, surgeons have access in some centers to a femto-assisted cataract surgery. What that is a laser, a LASIK-like laser, if you will, that we use ahead of the actual cataract extraction on the eyeball at the time of the surgery. And what that laser does is it helps to open up the cataract. It helps to give us a precise laser etching inside the eyeball of exactly where the new lens is going to sit. And it also can assist your surgeon with both making the initial incision in the cornea, but it also gives most patients benefits with reduction of astigmatism, just because they had a LASIK-like laser be the guide for the incisions for the surgeon. So there's a lot of tremendous benefits that can be given to patients during cataract surgery with that femto-assisted cataract surgery. There are different ways that surgeons go about getting the eye comfortable during the surgery. Some surgeons do just straight topical surgery where we use numbing eye drops or lidocaine gel during the surgery. You won't feel pain, but you might feel your surgeon touching your face. You could feel a little bit of pressure in your eye. These things are all very normal, but you shouldn't ever really experience pain. Most cataract surgeons are doing topical cataract surgery, meaning that the patients are not fully asleep with general anesthesia. There's always exceptions to every rule. Some patients are not candidates for topical surgery and they do need to be put to sleep. Typically, that's going to be done in a hospital-based setting. Most outpatient surgery centers, where a majority of our patients have their surgeries, we use kind of a light sedation. So we place an IV in your arm, kind of like a patient might have for, say, something like a colonoscopy or just a routine other medical procedure not done in a hospital. And that gives us the ability to help you if you're feeling a little anxious, if you're kind of uncomfortable, or just your back sore or something, you can't lay still for a longer than 5 to 10 minutes. Most cataract surgeries, if they're straightforward, will take the surgeon anywhere from 5 to 15 minutes to perform the surgery. So when you come in for the day of surgery, what you'll see is you'll see our nurses. They'll help you find a station or a bed to relax and change into a gown. They'll start an IV, we'll dilate your eye, and then you'll meet our medical team. You'll talk both to your surgeon and also to our nurse anesthetist or anesthesiologist who is working with us on that day. We will review the plan again to confirm all of the ideas about what your vision targets are, what are your goals for vision restoration. There are many different types of lens implants that can get a little bit confusing when it comes to trying to pick the right lens for yourself. Thinking about what type of vision you want to have after surgery is very helpful for your surgeon to help guide you into making a good selection for the implant that will last you for the rest of your life. Some implants give distance vision, some give near vision, some implants can give a full range of vision. And there's another implant called a light adjustable lens where we actually are able to use our preoperative measurements to measure your eye. We then remove your cataract and place this lens in the eye. It's the only lens on the market at this time where we let the eye fully heal. Once the eye is completely healed, we are then able to see what is the postoperative outcome. Once we know what your postoperative outcome was, or what kind of glasses you might need for distance or near, or kind of whatever you want for your vision, we are able to then turn to a computer with a UV light source and actually shine a light through your cornea and imprint your unique pattern of your eye right into this lens that creates sort of an absolute best-in-class custom fit for your vision. It's spectacular. The vision descriptions that I hear from patients with this technology, even now after using this lens for many years, still surprise me. I had one patient come in and tell me that she goes for walks, and yes, she knows when she looks up, she sees the tree, she sees little leaves that are green on the tree, she's always seen that. But now, after having the light adjustable lens placed in her eye, when she looks up to look at those leaves, she's actually seen these little veins on the leaves that she's never been able to appreciate before. Another patient who had surgery not that long ago, he's in his mid-60s, he'd had LASIK surgery back when he was in his 30s. And he told me, Doc, he's like, I thought I had great vision after my LASIK. I've never had vision like this. This is the best vision I've ever had in my entire lifetime. Thank you so much. And so, you know, as much as we want to take credit for a job well done, I really have to say that it's an amazing technology, and it's so fun being a cataract surgery in this era of sort of medical development, knowing that our patients have access to absolute premium outcomes if they choose to go down that path. Also, we can still do a great job with your cataract surgery, even if you want to do a traditional approach. Traditional cataract surgery is kind of what it sounds like. Basically, we're going to remove your cataract, we're going to place a lens in your eye. The lens that we use with traditional surgery is not a specific lens that is absolutely customized to your specific eyeball. Rather, it's more of a one-size-fits-all technology. That technology works well. It's going to give you sort of the majority of the correction that you're hoping for with vision improvement, but it always leaves kind of a little bit of meat on the bone, or at least a little bit of additional improvement to be had through new prescription glasses. Typically, most insurances will either decrease the cost of a pair of glasses after cataract surgery, or in some cases, they just cover the first pair of glasses after a cataract surgery, because they understand that these one-size-fits-all kind of basic technology lenses are not able to be completely customized to every single individual. Other than that, after surgery, we're going to have our patients in our center go home, and most patients have a clear shield over their eye right after the surgery. That is determined by the surgeon at the end of the case. Some surgeons prefer to put some ointment in your eye and put a full patch over the eye. Other surgeons are comfortable with a clear shield, and then some surgeons just sort of make a game time decision depending on how they feel it would be best for your benefit and your outcome. Either way, the next day you'll come into our clinic, we'll remove the shield or the patch, we'll check your vision, check your pressure, make sure everything looks appropriate for the first day. There's typically, for most people, a slight blurriness or fogginess to your eyesight right after surgery. That's very transient. It typically disappears over the course of the first week or so. Some people don't really experience much of that. Where it comes from, we do dilate during surgery, so we have to let the dilation wear off. It's a very strong dilation that we use during cataract surgery, so some patients are sensitive to that, and it can take over a day for some people for the dilation to wear off. Also, ultrasound is used during the surgery inside the eye to help break up the cataract into smaller pieces. And that ultrasound does release a little bit of energy into the eye that can cause some swelling in your cornea. And so that swelling needs a chance to kind of go away as well. That's one of the benefits, in my opinion, of the femto-assisted cataract surgery. Since we're using a LASIK-like laser anyway to make some incisions of both your cataract and potentially your cornea, we can actually take that laser before we remove the cataract and actually use it inside the cataract to chop the cataract up into smaller pieces. Think of maybe like dicing a cucumber or something into small little quadrants or into little patterns. And because the cataract is already sort of reduced and disassembled with the laser, when the surgeon goes into the eye with the phacoemulsification, the ultrasound, the surgeon's then only needing to use minimal ultrasound energy inside your eye to fully remove the cataract. This allows the patient to have a faster recovery. Generally, you're going to have quicker onboarding of good, excellent quality vision, and you'll have less recovery time overall. After you've been seen in our clinic on the first day, at home you'll be using some eye drops. It's really, at this time, most surgeons are using 3 different types of eye drops in the eye after the surgery. Most surgeons prefer to use an antibiotic, a steroid, and a non-steroidal anti-inflammatory. Different ways we can get these medicines. We can send 3 different prescriptions to your local pharmacy via your insurance, and then you can just pick them up via your insurance plan. Some patients have found their copays, even for generics, are quite expensive, $60, $90, $110 for some insurance plans. We did find a company here at Northwest Eye that is a compounding pharmacy willing to put all 3 medicines in one bottle for our patients. And then that is available for our patients to purchase at the optical, and it's somewhere in the $60 to $70 range. And so that I find to be very convenient. I like the convenience factor because my patients that choose that path only need to use 1 bottle of eye drops, and from that you're using 1 drop 3 times a day in the eye. Generally we say until the bottle runs out, but we're kind of watching you in clinic, and if you heal very quickly, some patients can stop the drops after only a few weeks. Once everything's all healed up, we do a final check on your vision to make sure that your vision is to your liking. If there's any additional adjustments or tweaking that need to be made, either through glasses or other options available, we'll tell you all your options. And then from there, you can enjoy a vision and a opportunity to function without all that impairment that you were experiencing prior to your cataract surgery. I like to make it simple for patients. I tell patients, just because I look in your eye and find a cataract doesn't mean that we're going to necessarily do a cataract surgery. I like to use cataract surgery as a tool to treat your vision problems. So you tell me about your problems in your vision. Let's see if cataract surgery can be a good solution for that. And if that's the case, now is the time to go ahead and proceed with cataract surgery. And if not, if you have some other issue leading to your blurred vision or your symptoms that you're noticing in your eyesight, common other ideas might be, dryness in the eye, can lead to transient blurriness in the vision. It gets better with blinking or with kind of really straining your eyes. We talk about how do we treat dry eye, and we work you through using artificial tear products and kind of some of the ideas that we have to help with that. Either way, at the end of the day, we just want your eyes to function to the best of their ability, and we want you to be happy with your vision. And that's what we're doing here at Northwest Eye, day in and day out, is we're trying to be eye wise. We're trying to help our patients know everything they can, both before their visits, during their visits, and after their visits. And we're very grateful that you've trusted us with your care. There you go.